Hello, and thank you for your interest in the Texas Trees Foundation work in the Southwestern Medical District. We have put this presentation together to give folks some background information and an overview of the project, and then most importantly, some information on how you can contact us to learn more and to get involved in the project going forward. First, I'll start with a little bit of background about the Texas Trees Foundation. It's a nonprofit that's been working in the Dallas area since 1982 and been on the forefront of environmental efforts throughout the community to transform our region and educate folks about the benefits of a better natural environment. And I want to go through today the project that is one of many projects on the Texas Trees Foundation plate to give a little bit of rationale on why the Trees Foundation is involved and why we all feel it's a very important project for the community, what we're hoping to accomplish and work with through the community to implement, and the process by which we'll go about doing that. And then most importantly, how we hope to hear from you regarding your thoughts, your ideas, your concerns about the project so that they can be incorporated into what we put together going forward. And fundamentally, the project is really grounded in improving human health as well as environmental health, and looking at how we can do so through redesigning streets in the medical district. As you know, health is really a lot more than healthcare. Everything from our current economic situation personally, which might add stress to our daily experience, impacts our health. Our own physical environment, where we live, what access do we have to parks and recreational areas, what's the environment like, can impact our health, as well as our educational level, our ability to afford and have access to healthy foods. What's our social network like? What kind of support systems do we have in place? And then ultimately, what is the quality of the healthcare system near us, and how do we access that? All of those contributors come together to affect our own personal health outcomes. And the Trees Foundation is keenly interested in the specific relationship between nature and human health. Study after study has shown there are profound positive benefits with a quality access between humans and nature. Can do everything from relieving stress and lowering blood pressure to shortening our recovery times in the hospital. If we have visual access to trees, there's studies that have shown that can improve our healing and our ability to recover more quickly. And now more than ever, this is important as we have experienced over the last several months with COVID and our sheltered in place. People are yearning for a connection with nature, and parks and open space are playing an even more critical role in our society as we look for these outlets for mental stress relief as well as physical activity. And so thinking about the project that we'll lay out for you in that context, it's really important to understand the connection that people have with nature and the role that that has in our own personal well-being. Excuse me. The other component of this is thinking through how we start to design spaces, landscape and buildings where we can key into patterns of nature and elements found in nature and use those to echo some of the benefits that you see through nature. And so looking at how we design buildings and spaces where they might improve our stress levels is something that we want to explore further through this project. And we have an amazing laboratory to look at this work through. The medical district is located just north of downtown Dallas. It's a huge job center. There's 37,000 employees and growing that go to work there every day. Nearly 3 million people visit the medical facilities in the medical district each year. It's a learning laboratory for medical students coming to learn their profession, as well as a neighborhood that has 23,000 people that live both in and around the medical district. So it's certainly a hub of activity. It's also a transportation hub. There are major arterials and mass transit lines that run through the area. So this is a critical node within the city of Dallas. However, the physical environment is not as healthy as it could be. A couple of studies that the Trees Foundation has done leading up to this effort that we're walking through today looked at both urban heat in the Dallas area as well as the urban forest in the Dallas area. And both of those studies indicated that there's work to be done in the medical district. It is one of the epicenters of urban heat due to the amount of paving that exists out there today in Dallas. It's also lacking in tree canopy. The U.S. Forest Service recommends 40% tree coverage. Southwestern Medical District currently only has 7%. And as you look at how that's distributed throughout the medical district, it's largely concentrated in big swaths of nature. However, it is largely lacking along our streets where we want and need that shade for comfort, particularly for pedestrians, as we try to encourage people to walk within the district. And secondly, the sidewalk infrastructure is lacking in places. And so this is especially important in the medical district as we're starting to think about folks with ambulatory challenges and how they might need to get from, say, their DART stop to their doctor's appointment. If the pedestrian infrastructure is either lacking or non-existent, that makes it a challenge for folks to get access to their health care. Similarly, the mass transit lines that come through the district, there are a number of stops. However, access to those stops is a bit limited. There's not any current bicycle lanes within the medical district. However, that is changing through this project as well as others that are underway. And so we're looking for that to improve, as well as looking at ways we can more smartly manage stormwater and drainage in the medical district and do so in a way that can help to both reduce stormwater quality and improve reduce stormwater quantity and improve stormwater quality. And as I mentioned, there is also a major transportation hub. 2 major regional arterials cut through the area, and the intersection of Herring Hines and Inwood Road, there are 82,000 cars a day that traverse that area. And so managing that traffic as we start to think about safely introducing better bicycle and pedestrian connections is certainly going to be one of the key things that we need to do as we evaluate design options for this project. And so all of this comes together to really reinforce this idea that we need to take a careful look at the medical district and think about ways that we can reformat the public space and our public streets in order to raise the bar for environmental performance, as well as our own personal and public health outcomes, and start to think about the systems that knit all that together, the open space network, the drainage systems, the transportation systems. How do they all work together to reinforce this idea of a healthy district? And for that reason, the Trees Foundation a number of years ago started to work on a project to develop a vision for this area and specifically the streets in this area and how they might perform better. And we're looking at it through 4 major lenses. As I've already touched on, the human health component as well as the environmental design component are key foundations to how we hope to improve the district. But we're also looking at it from an equity perspective. How can we think about and bring to the table the points of view of everyone that has or needs access to the medical district? And how can we improve their experience? And how can their ideas and their thoughts contribute to and shape the design moving forward so it truly is reflected of the public concern and the public desire for what the medical district could be? And lastly, how can we use this as an opportunity for learning and research? It's a 1,000-acre living laboratory, we like to refer to it as. And so what components of this can we test and learn from, so that as we think about investment infrastructure going forward, we can do so smartly. And so ultimately, how do we imagine a medical district transform to perform better environmentally, to be more open and inclusive and accessible, as well as to support healthier, active living? And as I mentioned, we started with looking at the streets and the network that crisscrosses through the district and reimagining what each of those streets could be. As we're beginning the implementation project, we're tackling two of the biggest projects first. The first major project is the Harry Hines Boulevard as it spans through the medical district, and looking at ways that we can start to introduce multi-use paths to encourage walking and cycling in a safe and comfortable way adjacent to the street. Thinking about how we can improve the tree canopy and biodiversity of plantings in the area, and how can we manage stormwater in another way so that we not only address areas where there might be concerns with flooding, but also think about improving the water quality as a implementation measure. And then the second major project is focused right on the intersection of Inwood and Harry Hines. As I mentioned earlier, it's a major transportation hub. It's currently a standard issue cloverleaf intersection. And while there's green space there, it's sort of locked up by ribbons of concrete. So how can we reimagine this interchange to not only manage the traffic through there, but to also open up opportunities for gathering and connecting and recreation in the heart of this very important district? And the possibilities are endless as we think about what that space could become and how we could use it. It's about 14 acres of land, and we think we can unlock about 10 acres of open space. And so that certainly is something that could become a huge asset to the district. And so we're looking forward to working with the community to start to define more carefully about what this could be and how we can better utilize that space. And so how are we going to get there? What's this process going to look like? As I mentioned, one of our main objectives is to learn from this. And so we're going to be using an evidence-based design process, which means first and foremost, we're going to scan the field and figure out what is already existing out there that experts have learned, and how can we best apply that to the challenges at hand in the medical district, and what are the design solutions that are most appropriate given what we know from past experiences. We also want to think very carefully and work closely with the community about what our priorities are, what do we hope to achieve with this project, and how do we measure those outcomes so that we can begin to model them during the design process and think about what various design solutions might mean with respect to those benchmarks. Will they move the needle in the direction that we want, or not so much? And do we need to reevaluate the design before we actually put it into action? And as I mentioned earlier, we want to create a living laboratory, a place that we can start to think about and learn about how different design solutions can impact not only air and water quality, but how does it impact the social network? How do people use the space? And is it done so in a positive way? How can it impact both their physical and mental and spiritual well-being? And ultimately, how does it change the way people use that space? And so we've brought together a team to do so that are touching on various components of the project, everything from how we are going to engage with the community and stakeholders so that they can shape this project from the beginning, to also helping us understand both the economic benefits of the project and how we can harness those in a way to help sustain the maintenance and operations of the project going forward. And then ultimately, how can we design this project in the best way possible? And along those lines, we've also brought together a team of local and national experts from a variety of disciplines that are specifically charged with critiquing all of our work. We've empaneled this group with expertise ranging from transportation and mobility to economic development, as well as looking at the cultural and historic aspects of the project so that we can make sure that we are looking at this project as holistically as we possibly can. And we have tasked them with specifically picking apart our work and helping us to brainstorm different and better solutions as we go through the design process, and to tap into their depth and breadth of experience to bring what they've learned through other projects to our work so that we can deliver the best project we can for the folks of Dallas. And so the scope of what we are doing and embarking on right now is designing the streetscape improvements along Harry Hines. That's the area noted in green. And we're also getting ready to embark on the early design work for untangling the knot of concrete at the center of the project and reclaiming that for open space and biking and hiking and other activities as a point of connection within the district. And the hope here is that we'll be able to sync these two projects up so that they can be implemented within short succession of one another. And so, most importantly, how can you get involved? Because we certainly want to hear from you. We feel that engagement is the cornerstone of this project. It is a driving force behind how we are going to develop our design. And we want to do so in a manner that brings all of the voices to the table. We want to be very thoughtful about whom all uses this district and whom all needs access to this district, and to get and understand each of those perspectives so that it can shape the project so that what we deliver at the end of the day is the best possible outcome for the citizens of Dallas. And another component of that is also making sure that all of the partners that are currently within the district as well are at the table, and to give us their thoughts and experience on their operations and how it might impact our design decisions, and make sure that we're looking at this as a collective and thinking about these outcomes for everyone. And so our first step really is to listen and to learn, to stop and have a whole lot of conversations. And so we're wanting you to reach out. There'll be an email address at the end where you can let us know your thoughts, as well as any other opportunities for us to come and speak to you. And then we want to take what we've learned and start to figure out, well, how do we turn that into action? And what are the most appropriate design solutions for this project? And how can we do that together in a co-design process where we work hand in hand to create the project? And then how do we continue that engagement? How do we continue to foster an open dialogue with the stakeholders as this moves from an idea into reality? And we're looking at about an 18-month process for those conversations and the subsequent design. The first component of the project, the Harry Hines streetscape work, we do anticipate beginning in early 2022 and having approximately 2 years worth of construction. And so with that, we hope to hear from you. Please reach out at swmdproject@texastree.org. We'd be happy to answer any questions or hear your concerns or thoughts that you might have on the project. Or if you'd just like us to give a more detailed presentation to you or your friends or your neighbors or your coworkers, we'd be happy to do that too. So thank you again, and we hope to hear from you.